Hello everyone, my fellow colleagues and I represent the American Dance Therapy Association, or ADTA for short, and we welcome you to our 50th annual conference. This year marks a huge milestone for the ADTA. We have continued to advocate for the development and expansion of a therapy called Dance and Movement Therapy, or DMT for short. The ADTA defines DMT as the psychotherapeutic use of movement to promote emotional, social, cognitive, and as well as physical integration for the individual. Body movement is a core component of dancing and simultaneously allows us to provide a means of assessment as well as intervention.
So the history of dance therapy. Throughout different cultures, dance is used to convey emotion, tell stories, communicate with each other, and treat illness. The ADTA was founded in 1966. Dance therapy can be helpful for a wide range of patients and diagnoses, some of which include people with restricted movement, including arthritis, aging, degenerative disease, and other causes. For children, it is often difficult to maintain their attention span because they have little patience with other forms of therapy, so children greatly benefit from dance therapy. Dance therapists believe that the body, mind, and emotion are interrelated, and therapy provides a means of communication beyond the self, enabling the individual to go beyond any isolation to connect, share, and express emotion and feelings with each other.
There are two ways to become a dance movement therapist. First, you can graduate from an ADTA graduate program, which are listed on the website, and these meet all the registered DMT credentials. Also, you can graduate from an accredited institution with a master's degree or higher with a general training in dance therapy. This also includes coursework in dance therapy as well as an internship and fieldwork. There are two levels that you can become as a DMT. First, you can be a registered dance movement therapist, in which this is the basic level that you can become, and it shows that you are ready for employment. After that, you become a board-certified DMT, in which you have extra experience and credentials. In this case, you are able to create a private practice.
Affordances of DMT for participants. There's the obvious. They're exercising, so they're increasing their heart rate and decreasing risk of obesity. But there's also emotional implications. For example, decreased stress, anxiety, and depression due to increased neurotransmitter release in the brain. For example, serotonin and dopamine. There's also increased interaction skills, so in group sessions, people are promoting relationships among peers. There's decreased progression of disability, so increased muscle strength and maintaining movement. There's also decreased hug times in older populations, so decreasing their risk of falling. Some precautions. Populations at falls risks need to be monitored closely. Also, cardiovascular risk factors may be present, so you need to look for warning signs like shortness of breath and pallor. There's also risk of minor musculoskeletal injuries that also require monitoring, for example, inversion ankle sprains. Overall, positives largely outweigh the negatives, inclusive of all populations with great health benefits.
There are three types of dance movement therapy. The first type is Shatsian, in which the patients begin in a circle and they engage in movements for a warm-up. These movements are typically really slow and really controlled. Props are typically used for this type of dance movement. The most common prop is a spandex cloth, in which the therapist wraps that cloth around the patients to make them feel more whole and centered as a group. Then the patients engage in a cool-down session. The second type of dance movement therapy is called increased body awareness movement. This approach relies partially on the idea that emotions begin as sensations in the body. This type of dance therapy begins with micro movements while the therapist is engaging in a meaningful conversation with the patient. The PT's hands are always on the patient's body, and once the patient embodies a specific posture or gesture, they bring attention to that movement in order for the patient to begin to have curiosity about that movement.
The last type of dance movement therapy is called internal, and this is when the patient creates the movement based off of how they're feeling. It's often done in a group or family session where collaborative work is encouraged, as well as problem solving and communication skills. Depending on the individual therapist, alternative expression modalities and psychotherapy methods may be incorporated. In conclusion, dance movement therapy is an active therapy indicated for many populations, including individuals with physical conditions including chronic pain, obesity, cancer, arthritis, hypertension, and cardiovascular disease. Also, individuals with mental health conditions including anxiety, depression, ADHD, poor self-esteem, and PTSD. Cognitive impairments including dementia and communication impairments, and it encourages social interactions in populations with autism or aggression issues.
Thank you all for attending our continuing education course, and we hope you enjoyed the brief presentation. Now here's a taste of a real DMT session.